I'm Gabriella.
Hi, I'm Dr. Patel.
Today we're going to be talking about women's health. So perimenopause and menopause are very hot topics in women's health. Can you explain what these are and what exactly is the difference between the two?
Yeah, so menopause means that a woman hasn't had her period for 12 months, and perimenopause is the time that leads up to it. So that can start a year before, 2 years before, 10 years before.
Oh, wow.
So it's very difficult. And during this time, what's happening is that the periods are getting irregular. So during perimenopause, sometimes you'll have a period for a few months, and then you won't have one for a few months. Then you'll have 2 1 month.
Oh, wow.
Then they'll be heavier. Then they'll be lighter. So this is a hormone change time.
Sounds very difficult. So what symptoms do women typically experience during perimenopause and menopause? Is there a range, and do they all experience it the same or differently?
So every woman experiences differently, just like every woman experiences menstruation differently. Some women have a lot of cramps and mood swings, PMS, and other women don't. So it's the same on the other side. Women will experience, because of the hormone change and the fact that it's dropping, they'll have hot flashes, mood swings, weight gain, insomnia, just feeling kind of like tired. So all those symptoms.
So this is obviously a natural part of women's health and aging. What can women do, or should they really do anything to alleviate these symptoms?
Yeah, I think for quality of life, women should do something. It is a natural part of aging, but the way I look at it is, when you lose your vision, it's a natural part of aging, but you wear glasses for quality of life. And so I do think women should do something about it, to help them have, you'd love to sleep and not feel hot all the time.
So what exactly do you recommend for women to do for these?
So for some women, and those who don't have any reason not to take it, I like hormone replacement therapy, but there are some women who like to do supplements, so then I'll recommend supplements for them.
Okay, and then are there specific supplements for menopause, or what do you look for in a supplement for menopause?
So there isn't one thing particularly, because menopause is a little bit complex. Yes, it's like you've lost your estrogen and progesterone, but because there's different symptoms, the supplements help with those symptoms.
Okay.
So if I wanted to treat someone who had hot flashes, I might look for something like black cohosh, which helps calm those symptoms down. But I also want to make sure that it's kind of a stressful time, so I'm also adding something in that supports their adrenals and their immune system as they go through this change. I might also add in something that helps support their weight, because many women complain about weight gain with menopause, and so they may need to take some stuff for the hot flashes, but also take something for weight.
Oh wow, okay. So it sounds like there's a lot of different symptoms and methods of alleviating these. So obviously menopause affects women's physical health as well as mental health. So does this put them at risk for other health conditions?
Yeah, women who are, in menopause or postmenopausal tend to be at a higher risk for heart disease, osteoporosis. They also tend to complain of brain fog a lot. So mentally they're just not quite as sharp, sometimes. So I think that those are risk factors for other things, and the supplements may not completely take care of that, but it'll help some of the symptoms that they're having.
Okay. It's good that there's a lot of options and research for women's health.
There is, because it's usually not talked about a lot. Most women just say it's a natural part, like you said. It's just a natural part of what happens. And women don't talk about it, and they don't realize that there are options, there are things that they can do that improve their life. And I feel like we should talk more about it, because it's a real problem and we can definitely do more for it.
Yeah, I feel like it's really important to help alleviate the symptoms and just improve their overall quality of life.
Yeah.
Well, thanks for listening. See you guys next time.
Thank you.